The strategies for safe movement of patients as shown in this video are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. Whenever assisting a patient with movement, it is important to instruct the patient in ways that they can assist with the movement. If the patient knows what to expect because you are communicating with them, they are less likely to move in a way that may come as a surprise to you and throw off your own balance. Also, instructing them how to assist helps promote their independence in completing the movement and makes your job easier, as you may not have to provide as much physical assistance. This video will cover the rationale of using a gait belt, also known as a transfer belt, how to apply it correctly, and how to utilize it during a simple sit-to-stand transfer. I'll demonstrate the use of a standard canvas belt with a metal buckle. These canvas belts can be laundered and therefore used for different patients. There are other variations of gait belts that can be used, such as vinyl ones, or ones with plastic buckles that would be appropriate for use in radiology. The purpose of the gait belt is to help you control the patient's center of mass during movement of the patient, control their descent should they begin to fall, and eliminate the need to hold on to the patient's clothing or under their arms. Holding or lifting under a patient's arms can lead to injuries to the patient's shoulder, particularly if the patient starts to fall. One of the first things that you may want to do is explain the gait belt to the patient and why you're using it. When you apply the gait belt, it should be positioned low around the patient's waist, near her center of mass. The end of the belt goes through the buckle, through the side with the teeth first. Then, push the end of the belt through the second opening of the buckle. The belt should be applied fairly snugly on the patient, tight enough that it won't slide up excessively on the trunk when the patient stands up, but loose enough that you can slip your fingers underneath the belt. In general, you should place the belt a little tighter than you might think with the patient sitting. It tends to loosen up a bit once the patient is in standing. Sometimes you will need to tighten it further once the patient is in standing. When holding onto the gait belt, grasp it so that your fingers are coming up under the bottom edge of the belt. Don't hold it from the top edge. If the patient begins to fall, you will likely lose your grip if your hand is positioned this way. Next, you'll see how I'm using the belt to assist the patient into standing. The patient must lean forward to shift her center of mass over her base of support, which is in this case her feet, as she stands. I'm using the gait belt to guide the patient's center of mass forward. I'm not pulling straight up on the belt. Rather, I'm using it to help direct the patient forward and up on a diagonal. To assist the patient back into sitting, I'm going to make sure she is in contact with the bed, reaching back with her arms. I'm using the gait belt to control the descent of her center of mass as she sits. You do need to be cautious if the patient has incisions or lines, such as feeding tubes, in the abdominal area. Usually in this case, it's best to apply the gait belt higher up on the trunk to eliminate the chance of the gait belt sliding up over the incision or line. However, it's less ideal in this location because it no longer is located near the center of the patient's mass, where it is best used to control the patient's balance. You may also need to be cautious when applying the gait belt to female patients. Unless there is a contraindication to placing the belt on the abdominal area because of an incision or line, make sure the belt is placed under the breast tissue, not over the top of it.